a podcast I was recently on, and it's called the Checkable Health Podcast. Check it out. The podcast was founded by Patty Post, and she's a parent, she's a patient, and her mission is to simplify and streamline healthcare for families just like hers and just like yours, which is cool because I empower patients to realize that their symptoms are not in their head. So we're both trying to empower everyone everywhere. It was so awesome to be interviewed on Patty's podcast, and we covered the differences between conventional and functional medicine. A lot of you guys asked me about that. And of course, we gave practical steps, how to make changes and help you get to the root cause of your symptoms. Why? Because you always knew there was a better way. So check it out, and I'll see you guys next week.
You started the new method. So I would love to first start with that, because there's so few providers that like go out and start something, and it's very brave of you. And I think it's very brave because you are very, being a functional medicine provider is different from traditional, and you are not run by big pharma. And I really respect that. I love it. So it's all yours. I'd love to hear what you say when, like, what's going through your mind when I say that.
So much is going on my mind. The first is why we started, which I'll tell you in a minute. But the other thing, functional medicine, you kind of have to be willing to take a risk, not just on the business side, but to make the statements that you need to make, because there's going to be some hate, and you have to really. I'm so passionate about my patients that I'm willing to take the hate. And you could see, if you go back to any of my beginning podcasts, was scared to say things out loud. So I would talk about sleep, and I would talk about hydration. I was scared to say the thing like IBS is not real and fibromyalgia is not acceptable. So, because now there's a lot of pushback, and you have to be like, I'm here for you. I'm just saying this for you, not against you. I'm here for the patient. So there is an evolution in there. But to get to why I started, and when you're in functional medicine, every single doctor NPPA that's in functional medicine is either there because they were sick or because their family member was sick, and conventional medicine failed them. And this is not a diatribe against conventional medicine. I still practice conventional medicine. You need the meds when you need the meds. It's just not the full picture.
Yeah. Yep.
And in her case, she had 2 severe autoimmune issues, PMLE and then psoriasis. For those of you who don't know, PMLE is basically an allergy to the sun. So,
I didn't
go live with that. Yeah. So, an allergy to the sun. So we had to live like vampires. When I do my talks, when I speak, I'm like, my wife used to be a vampire, but not the cool kind.
You're like, wait, what? Why?
Yeah.
So what would happen? What are the symptoms?
So for most people with PMLE, it affects everything except for the face. They'll be out in the sun, and then it's delayed. A day or 2 later, they will get a rash. They'll feel almost flu-like symptoms. And it takes a really long time to get diagnosed. Maybe it's lupus, maybe it's another autoimmune, also because there's a delay. It's not immediately after the sun. It takes some time to make that connection. In her case, she had the atypical form, so it actually included her face. At the time, she was a Division I softball coach. So you can imagine she had to make a career change. Yeah.
Stop it. She made a career change for it?
Yeah, she couldn't be outside anymore. That's how she got into medicine.
Holy, that's nuts. So now she's in medicine, she did a 180.
She did a 180 as a full-grown, successful adult. She could not be outside anymore. She went back to school, and she became a PA. That was actually before I met her.
Oh my gosh.
So when I met her, she was already like a full-blown vampire and a full-blown PA.
She's smarty pants too, and very brave.
And then she got this. So, but we lived with it, right? As many of your listeners, you kind of live with it. You do the thing and you figure it out and you live with it. Whatever it is, your joint pain, your brain fog, you live with it. And usually something else pushes you over the edge. In her case, it was psoriasis. And her psoriasis was so severe, like she couldn't button her shirt. She couldn't hold or open things. She couldn't walk in her shoes. So that was like, okay, we have to do something. And anyone struggling with autoimmune, that it's either immunosuppressants or steroids. Again, not against it. There are certain people who really, really need it, certain diseases that need it. But we knew there was something else, which is why I call it the new method, because my patients always know. They know there's a better way. So this was 1 million years ago, before the internet is what it is. And so someone told us about functional medicine. We're like, okay, this is not going to work. For those of you listening and not watching, my eyes are rolling heavily. And it's not going to work. But we're like, we have nothing to lose. Let's just go see this guy. Whatever. And he had this crazy idea that this all has to do with her nutrition, which is outrageous, right?
Yeah.
I'm joking. So,
Wow,
like,
the thing put in our body actually affect how we.
yeah,
Okay.
and we were healthy, right? In air quotes. We're relatively thin, athletic. We thought we ate really well. So, like, how could this possibly? Who are you to tell us that we're not eating well? It's one thing if we're in McDonald's all day long, but we were not. But we were like, F it, let's try it. So we tried it. Her psoriasis disappeared. Her PMLE reversed, and we got our life back.
Okay, what's the timing? How long did that take?
The psoriasis cleared up within weeks. Like, she would take pictures and she's like, what's happening? Like, it would just reverse. We would just watch it literally reverse. And then the PMLE was like slow because it wasn't like we just went out and tested it because can get sick. So all of a sudden we're like, wow, we didn't cross the street yet. And because she would get tingling, she would know what happens. She's like, oh my God, the tingling's not coming. And then we would stay longer and then longer. And now she could that's it. We're normal. We could be outside. Vampire life is gone. Yeah. It's nuts. No meds, never needed it, just lifestyle change. So I was like, this is crazy. I have to bring this back to my practice. At that point, I already had a primary care practice, conventional medicine, did the same thing that I, accuse my colleagues of. I would tell people, you're fine. It's in your head. This is what I would do. Your labs are fine. I didn't know better. There's no malice. I just didn't know better. So I started doing classes and just bringing slowly small things into my patients. And then I got my PhD in integrative medicine. And then I created the new method. So the reason it's a method is because I still come from a place of conventional medicine. So I want things that I can track, things that I can measure. I want to make sure that it's not just haphazard. So, so we created a method where we kind of we do a discovery session with our patients. We get to know what's going on. And then we use the software to track their symptoms. I can get into that a little bit more, but
interesting.
That's what the new method's about.
So you don't just take the lab work and then give it to the patient, read it at their visit and be like, okay, bye. That's what happened.
So I could tell you in primary care, I still do that because it's a volume-based business, right? Like we see 60 patients a day in primary care. It's just the nature of it. Again, there's no malice. Your primary care provider is doing the best they can within the constraints of a system that's designed a certain way. And in primary care, we are trained to find disease. If you have disease, we'll treat it or refer you to the right person. If you don't have disease, there's no room for you in primary care. There is no room for shades of wellness. Hey, doc, I know I'm not sick, but I still don't feel right. I don't feel the way I used to a year ago. Oh, it's just your age. Oh, it's just your hormones. Oh, you're stressed out. And it's not because they're bad people. There's no way to measure it in conventional medicine. There's no test for unwellness. Yes.
Go walk, get some more exercise.
Get some more exercise, drink more water. Yeah. What's going on at home? Is everything okay with your spouse? Like, so, there's an insinuation there. That's why I wrote the name of my book, is It's Not in Your Head, because there's an insinuation that like you're a little hysterical, especially if you're a woman, you're a little hysterical. So in functional medicine, we spend time with our patients because we design the system differently. We create a compensation strategy that's different for the provider. So we spend time, and we also understand that the lab is not everything, because the labs sometimes change later on. So I'll give a classic example. People know diabetes. I like to use this as a metaphor. If you're diabetic today, your test shows that you're diabetic today. Did you just become diabetic today? Of course not. This was 20 or 30 years in making. So if I tested you 5 years ago and you weren't diabetic, that doesn't mean you weren't pre-diabetic. It's the same thing with sickness. You can have symptoms for years before the markers change in your blood. So because the marker didn't change, does that mean you're not on your way? Of course, on your way, especially with autoimmunity. And so in functional medicine, we understand that the symptoms are telling us something. Something is wrong. Something is being agitated. And it's nice if it's validated by a lab, but it's not necessary, because we're going to treat the symptom. We want the headache to go away. It doesn't matter to me that there's nothing on your MRI, that it's normal. You still have a headache. Why do you have a headache? Exactly. You have joint pain. It doesn't matter to me that you're negative rheumatoid arthritis. You still have joint pain. You still can't, bend down to pick up your wallet. So that's the thing we're going to treat. So it's a completely different model.
So how do you treat it then if you can't? So you're diagnosing with a symptom, but then how do you treat it if there's joint pain, for example?
That's a really great question. It's a really good question. So we understand that if you're unwell, something's triggering it, right? You have a headache, let's just go with headaches. Something's triggering it. So our goal is to figure out what's triggering it. So the very first thing we do is clean up your nutrition, because that is what you have 3 times a day you're putting into your system. Most likely, we're going to find it there. So we completely eliminate initially, not forever, right? Don't panic. This is not supposed to be for your forever life. So we eliminate, because people are like, I can't do this forever. I can't.
Your life.
Yeah. So we eliminate and we see, how do you feel when we bring you down to basic? If your headache went away, your joint pain away, your stomach never felt better, your brain fog is gone, everything is wonderful. Well, now we know that something on your plate used to trigger you, right? And it may not be something unhealthy. It may not. It doesn't have to be, McDonald's. One day McDonald's is going to say something to me because I keep saying their name.
You're not going to get for sure.
I'm definitely not getting sponsored right now. I'm not going to ask to be sponsored. Yeah. So then, okay, I feel great. That's one scenario. I feel great. Awesome. So now we're going to start reintroducing things slowly based on that symptom. Okay, my headache's gone. My ringing in my ear is gone. My joint pain is gone. Awesome. Let's reintroduce, I don't know, chickpeas. Oh man, every time I eat chickpeas, my joint pain comes back. Guess what? Chickpeas aren't for you. So we introduce things based on those symptoms. Sometimes we'll completely eliminate and the patient's still not better. Somewhat better, and I'm not there. So now we know we need further testing, but not conventional testing because we already did those. I do those to begin with. Do we need mold testing? Do we need hormone testing? Do we need heavy metal testing? Do we need specialized Lyme testing? Maybe, depending on the symptoms. But I never start with those specialized tests because 90% of the time it's the plate. It's what's on the plate. So you peel it back. You go until you find it.
Are people willing, once they get to you, are they willing to make that change? Or do you have people that are like, I'm not going to change. That's my enjoyment of life, is eating my crap I like to eat.
Yeah. Most people are not ready. This is not volume driven business. This is our patients. We call them game changers because they are ready to make a change, and they're amazing. They're the most amazing humans from all walks of life, all demographics, all politics, all shapes and sizes. The most amazing humans. Every Tuesday, I have a call called Tuesdays with Dr. E for my game changers, and whoever wants to comes on. And we're national at this point, so people come everywhere. And every single Tuesday, it's the highlight of my week. I come off like a cloud, just getting their energy. They're amazing humans. So they're humans that have hit a wall. They can't take it more. Each one has a different issue going on. The common denominator is that they're inflamed. They're not feeling well. And everyone in that group understands that struggle. They're people who are ready, right? And they're ready. And that takes resources, financial resources. And of course, yes, it's expensive, but that's a prioritization issue, right? Like we all know that we make some questionable choices with our finances. So where am I spending it? Am I spending it here or am I spending it here? Am I my own priority? Is my health my own priority? Time to meet with me, time to meet with my coaches. And then the decision to let go of the food that's causing it. At least give it a try. Not everyone is willing to do it. The people who do it are successful. I mean, it's just amazing. It's the most humbling experience. People tell you, I've never felt better.
These game changers. These
game changers. They're just amazing. It's the most humbling experience. But I just want to put it out there, like without judgment. If you're not at that place where you're ready, that's okay too. This is why my primary care practice is also still busy. I'm proud of you for going for your annual and taking your meds. If that's where you are right now on your journey, where you are not quite ready to make those moves, but you're at least showing up, getting your blood pressure checked, taking your meds, that's okay too. But when you're ready for more, just know that there is more, whether you work with us or someone else, but there is more to medicine than just the blood test and the pills.
So what you're saying as a functional medicine physician, so I'm located in North Dakota. So I had Dr. Keneally on like 9 months ago. If you know Dr. Keneally, she's in California. She's amazing as well. She has The Cancer Revolution is her book. You two are like cut from the same cloth. And she was my best episode. So let's get a little competition here. Let's see if you episode and listens. I'm
okay with number 2. I love empowering other women. If she's good at one, let her be one. I'm okay with 2.
Oh yes, you'll follow her now because you'll really like her. And you will not believe her age when you see her, and then you'll find how old she is. You're like, holy crap. Yeah.
Amazing.
She does amazing things for her patients, just like you were saying. She really focuses on oncology versus
Mm,
autoimmune.
yes.
Um, in North Dakota, we don't have these resources. So like as you're saying this, I'm like, I want to be a game changer. So
Yeah.
that I can work with you. Or like
Yes.
my parents, my dad like always loves to be healthy, but I know he makes bad decisions. He's 81 and in his mind he's like 23.
That's
He could
awesome.
work with you, right? I mean,
Yes,
anybody.
absolutely. Absolutely. So in New York and New Jersey, I can prescribe and adjust your meds. But
Mhm.
outside of New York and New Jersey, we call it coaching, but I'm doing functional medicine, right? So I'm coaching
Okay.
you, I'm giving you everything that you need. And then if we need a prescription, I can say, hey, talk to your PCP. This is what we need. I'll even get on your phone with the PCP and say, hey, this is where we're at. I will do whatever it takes to help you move the
Yeah.
needle, or sometimes write a note. I have to say, most PCPs, if they see that their patient is improving, they've lost some weight, their numbers are getting better, they're like, yes, yes, 100%, let's do this. They want
Well,
their patients to get better. Yeah, totally.
that's why you went into
So,
medicine.
yeah, exactly. I was surprised. I mean, we had to become national because of the demand. Because just like you said, once I hit TikTok,
Mhm.
everyone was coming from states that don't have this. And they're like, I
Yeah.
am here. I am there. How can we work with you? Utah was one of my first patients. And they're like, hello. And I was like, oh my God, yes, let's figure this out. So
That's awesome.
yeah, it's been a humbling experience because I really truly believe that I'm here for a purpose. It's not from me, it's from above. It just goes through me. And
Mhm.
so when this happens, the more people that I can reach, and I know this sounds insane and maybe woo woo, but the more people I can reach, the more I am fulfilling my purpose on this earth. So it's
You're right. That's amazing. Like what you were talking about, your wife's story, even, and then how you both are practicing this. Like she didn't magically go from being a D1 softball coach to being a
right.
P. Like that's a divine
That's
plan.
divine intervention.
Yeah.
I didn't know who I was speaking to, so I didn't want to go that. but that's divine intervention. And I said that too because I would not have met her if she didn't have this disease because we met working in the emergency room together. So I'm like,
Uh,
I'm so grateful that you had this disease because I met you like this. And then we
that's so,
started this journey together. But
that's cool.
yes, it's 100% divine intervention.
So a friend of mine, she listens to this podcast. Her name is Madison. She's very small woman, like less than 100 pounds, was in the emergency room on and off for a year and travels quite a bit. So unfortunately she was ended up being in the ED instead of, going to her primary care or going to specialists that knew her. She ended up being diagnosed with Hashimoto's.
Mm,
And that was my first time hearing like, oh, autoimmune disorder. So now you're saying autoimmune. I don't think a lot of people know what that is. And then specifically what Hashimoto's is. Now I'm aware of it and I hear of other people. So I don't understand, why is it called autoimmune? Like how do those
okay.
words, what does it mean? And then what is Hashimoto's?
Okay. Excellent, excellent, excellent question. Autoimmune means that your immune system is attacking the self. Auto means self. Okay.
Oh, got it.
Yes.
Okay.
So auto means self. So it doesn't mean like auto or automatic. It's auto means self. So the immune system is attacking the self. There's something happened, and instead of attacking a foreign object like COVID or measles or whatever, it is now attacking the self. So people who have rheumatoid arthritis, it is attacking their joints.
Uh-huh.
People who have psoriasis, the immune system is attacking their skin. It's an autoimmune of the skin. People who have Hashimoto's thyroiditis, the immune system is attacking the thyroid. So
Ah.
autoimmune means body's attacking, and then depending on your genetics or other things, it will express itself in a particular organ. This is why a lot of the treatment for autoimmunity is the same, both in conventional medicine and in functional medicine. So in conventional medicine, since there's an understanding, oh, this immune system's fired up. This immune system is now attacking itself. Okay, here comes conventional medicine, and they'll give you an immunosuppressor. Okay,
Oh,
that's
yeah.
why it's almost always the same meds, no matter what autoimmune you have, because the idea is just calm down the immune system.
Mm-hmm.
Patient feels better, joint pain goes away, skin gets better, but the entire immune system has now been suppressed. So they are now susceptible to getting sick. And then they have, white blood cell issues, and it can cause, the medication itself now can cause a lot of side effects. So if you can't find the cause of your autoimmunity and you're suffering and you're in joint pain, you're debilitated, of course, go to the rheumatologist, get those medications, but understand what's happening. So that's one way to treat it. Functional medicine says the same thing. Like, I got it that you have a skin issue and you have a thyroid issue and you have a joint issue, but all of you have inflammation that's causing this autoimmunity. So we focus on the inflammation, which is why the similar, I shouldn't say, a similar protocol for you will help your thyroid. And for the person next to you, that similar protocol will help their joints, because their problem is not their joints or the thyroid. The problem is systemic inflammation. So it's right. Starts to make sense.
Simple. It does make sense.
It's so simple. Yeah. We forget that everything's connected.
Yeah.
You go to the thyroid doctor for your thyroid. You go to the skin doctor for your skin. You go to the GI for the belly, and you forget that's all connected. Hashimoto's is this. So thyroid issues, without going too detailed, thyroid means it's underperforming. The hypothyroid, there's also hyper. Hypothyroid is underperforming. It's not producing enough hormones. So then you have to say, why? Why isn't the thyroid producing enough hormones? And there's a few reasons, but the most common reason why is an autoimmune thyroid issue. And the name of that autoimmune thyroid issue is Hashimoto's.
Oh, okay.
Okay, so Hashimoto's. The problem with Hashimoto's, and I've done a few episodes on this. Actually, 2 weeks ago, I did another one because it's so common and it affects women, especially in this country. The problem is when you go for your annual, they will test your thyroid. My thyroid is low, or my thyroid is normal, or my thyroid is high. So it's a test. It's called TSH. Great. I got my TSH tested. Doctor said everything's normal. So weird, because I'm having trouble losing weight. My hair is thinning. My mom has a thyroid issue. My aunt has a thyroid. But every time I go to the doctor, they tell me my TSH is normal.
Yeah.
So I guess I don't have a thyroid issue. And you go along your merry way. So again, primary care is doing exactly what we were taught. We were taught TSH only. Have a nice day.
Yeah.
However, there is another test, which is called thyroid antibodies, which can show you if you have antibodies to your own thyroid. But we don't run that test in primary care. So
we want it?
We don't run it.
You don't run it?
In primary care, it's not run. The assumption in primary care is that TSH is fine, the whole system's fine. In functional medicine, we're like, wait a minute, something's up. You have all the symptoms of thyroid. Your whole family has thyroid. Why don't we test for antibodies? And so many times I will find antibodies, but their TSH is normal. Okay, so
you could test at home, like an antibody test.
No, it's a lab test.
No one's ever invented that. They've never, and so that's why
it wouldn't. No, it wouldn't make sense to. Like, you can have antibodies to a million different things. It's not one antibody. You're thinking of like a COVID antibody test. That's specific for COVID.
For COVID.
Right? This is specifically for thyroid. So what you need is a provider that's willing to run what's called a full thyroid panel, which is TSH, T4, T3, antibodies, reverse T3. But most providers won't do that. Not out of malice. It's just that if TSH is normal, there's no medicine for it.
Yep.
In functional medicine, we're like, oh, man, you have antibodies. Your body's attacking the thyroid. Let's act on it right now before the thyroid has an issue. And what is causing your body to attack the thyroid? 99% of the time, it's gluten for Hashimoto's.
Really?
Yes. So you put the patient on a gluten-free diet. You clean them up a little bit. You take them probably off of dairy because it's a little inflammatory. You watch the antibodies go down. The patient starts feeling better. And hopefully they never develop the thyroid issue. If you already develop the thyroid issue, doing that will calm it down so your thyroid doesn't get worse. Because the point is, if you start understanding the thyroid Hashimoto's is not a thyroid issue, it's a systemic issue, you have to calm down the system. Otherwise, your thyroid's going to continuously be under attack. So
it's literally under attack.
It's literally under attack. It's literally you should not have antibodies to your own thyroid. When you do it, your body's actually attacking your thyroid. That's what Hashimoto's is.
We produce antibodies when we are, like, when you're sick, that's when you produce antibodies, right? Like,
when the body recognizes something as foreign, it attacks it. So it's not supposed to recognize the thyroid as foreign.
Mm-hmm.
But, right. But that happens with Hashimoto's, right? Just like it's not supposed to attack your own joints. Or if you have psoriasis, why do you have psoriasis? Why is your skin erupting?
Yeah.
It's
There's
erupting because
something going on inside.
your skin is your neon sign to your belly. When
Yeah.
your skin is off, your belly is off. You calm down that belly, the skin gets better.
From when you were talking about let's clean them up. Do you like have you eat for like a week, just like 5 things just to keep it
No,
clean?
not 5 things. We give them, we remove a lot of the offending agents. Definitely more than 5 things. We don't want people, we don't want people hungry.
Strawberries and raspberries and I don't know. You
Yeah, I
talk a
mean,
lot about
we remove a lot. We remove gluten, dairy. We temporarily remove all grains, all legumes. We limit the type of fruit. We limit the type of vegetables temporarily to kind of clear the weeds and clear out the field. As I mentioned before, we use this really cool software that tracks people's symptoms. So you walk in and so 0 means you have no symptoms. And the further away from 0 you are, the worse you feel. So you come in, your symptoms are 150. After this, a month later, we're going to ask you your symptoms again, and you won't have access to your previous answers. Keeps you honest, keeps us honest, keeps everybody honest so we could be accountable.
Yeah.
And we want that 150 to go down to 100 to 70. You come back and you're like, oh my God, now your symptoms are 75. We're halfway there 1 month
Yeah.
in. Yeah, it's
So
amazing.
cool. That is
I
so
cannot even
cool.
tell you. It's amazing. I mean, I have people who say to me, it's the first time I've been able to play with my kids in the playground. People
Oh,
who, yeah,
wow.
no, it's unbelievable. It's unbelievable how this affects people. It's just life changing. I had one woman who told me, I've been on allergy medication for the past 25 years. I haven't needed one. Just so many things that people just
Wow.
accept as their normal.
Yeah.
And it's just gone.
That has to be hard though, because like when I start a new eating plan, I feel like crap. I get a headache, tired, like, oh my gosh, I can't do this. Is that what the coaching helps you through that first month?
That's a great question. Yeah. So why the new method succeeds so well with our patients is because of the level of support we provide, because you're 100% on point. I hand you a piece of paper. I say, I'll see you in 30 days. No way. That's not happening. It's not happening. So like I said, every Tuesday, an hour and a half, I'm right here on my Zoom, right here in this office. All my game changers hop on. Whoever wants to, they ask a question. So that's every single week. We have an app only for our game changers. When we have a live human there Monday through Friday, there's a question. Because we don't want you going down the vortex of Google. Should I take this? Should I not take this? Ask us. We'll tell you, right? And then on the app, we constantly putting in recipes and quick snacks and things to help you get through it. Some people are looking for salty. Some people are looking for sweet. What can I do? And then you use as much or little of the support that you want. And we have some people who are like amazing. They're there for the whole hour and a half that I'm on. They're on Circle's name of the app every single day. And then I have some people who just hop in. Hey, I'm between clients, but I just have a quick question. Great. Ask a question, go. And then, of course, every single month they have a one-on-one with our coach and we make a new plan for the next month. But we recognize that if we're not available, that you're going to listen and you're like, yeah, I could do this. I could do this. Then you go home and you're going to go into your kitchen and be like, what the heck do I do next?
Right. You're gonna get like the Jif peanut butter and like an English muffin because that's a fast snack that you can make.
Yeah, exactly.
Right?
And then also hearing from other people like, hey, this is what I do. Oh, that's a great idea. Hey, this is what I do. And it's so empowering. And then to hear everyone struggling through it.
It's like therapy. I mean, therapy is so healthy, right? With our mental health that
yes,
it's holistic. It's a lot what you're saying inside of the body. It's on our external factors. What's happening up here is connected with what you're putting in your mouth, and you can tell yourself a lot of things and rationalize the bad eating, right? Like
absolutely, you can. You're like it's peanuts. It can't be bad for you. Let me just have some. Yeah.
Yeah. Yes.
Yeah.
Well, what do you think about seeds, like seed oil? I've been reading a lot about seed oils, like, oh, stay away, so bad. And my brother actually ended up finding he was allergic to all seed oils, corn oil, safflower, or safflower. Safflower is different than corn oil, right?
Yeah, it's different.
Changed his life. Like you mentioned tinnitus, his ringing of his ears
yes.
were gone after removing this. What do you think about seed oils?
Well, before I go into seed oils, I just want to say anyone suffering from ringing of the ears, unless it's like post-trauma, people who are exposed to loud noises, just recognize that it's actually inflammation. And a lot of people suffer for years not realizing it's your body telling you, we don't like what you're feeding us. And just like with your brother, you remove the offending agent and the ringing in the ear goes away. I've seen it time and time again. I ended up writing my thesis on it, that people are just, they're miserable for years. And I learned in school that tinnitus does not go away. I say tinnitus. Some people say tinnitus. There was a whole war on TikTok about it. However you pronounce it, spell it, just whatever. If you have ringing in your ears, just know that unless it's traumatic or like secondary to hearing loss, there is a huge inflammatory component. And if you can modify your lifestyle, you can likely get rid of it, if not reduce it. And it's a game changer for people because people lose their minds from it, as your brother, I'm sure, would say.
Just lose their mind. Like literally, it's so
it's horrific. Yeah, it's horrific.
So it's like an alarm going off in your head, like, oh my gosh, I am exploding inside. Not exploding, but you're so inflamed.
Yeah, it's your body saying like it's another neon sign for that person. It's going to be tinnitus. And for, like I said, for you, it might be eczema, and for this another person might be joint pain. And he will notice that if his diet's off, the ringing in the ears will come back. Or if he didn't sleep well for a few days, it'll come back. It'll be his inflammatory trigger, and he'll know, okay, let me get myself back on track. So he kind of has like this internal, So tell him to pay attention to that. If he suddenly finds it coming back, there's something in his life again that's happening that's causing that. As far as seed oil, corn is the devil. No corn, no high fructose corn syrup, just no corn. Not because the vegetable itself is bad, but it's because what we've done with it in this country, we've put it in everything. And so now it just raises our insulin, raises our inflammation. We've made a mess of what corn should be, which should have been like corn on the cob once in a while. We've made a mess of it, and it's in everything. So no corn. As far as seed oils, I would have to say it really depends on the patients. I have some patients who do well, some patients who don't do well, but avocado oil and olive oil is kind of where it's at. And the coconut oil, if you're that is really where it's at.
Okay. That makes sense. Like not to, you're not going to have a thing of canola next year.
Yeah, no, you should not have canola oil. Like, yeah, I know it's a hard one, guys, because it comes in a big jug, but let's try to stay away from that one. And here's the other thing. The big Crisco. Yeah. For those of you listening, don't get scared that it has to be perfect. When you're on social media, everything looks, oh my God, I'm eating kale and I'm making a smoothie and everything looks so easy. And obviously we did like 1,600 takes before we showed you the smoothie.
Let's be real.
So let's be real. It doesn't have to be perfect. You have to meet the patient where they are. So for some people, getting them from a full sleeve of Oreos to 1 or 2 is a win, right? So let's get the wins that we can. And sometimes it takes, I did not get, if you see what I eat now, it took me years to get here, right? So first I eliminated this, it's not overnight. So congratulate yourself for whatever you're willing to do. And it's not an all or nothing game. It's not all or nothing game. So wherever you are, if you're listening to this, wherever you are, if you move one step, that's such a win. And don't forget that.
Yeah, don't beat yourself up. And it is just eliminating things from your diet, or else like, you're stagnant. If you start walking 10 minutes a day,
oh my God,
great change in your life.
10 minutes a day. I'm glad you brought that up. Oh my God, I could talk forever. 10 minutes a day actually creates a chemical in your brain called BDNF, which is actually preventative for dementia and Alzheimer's. So 10 minutes a day, you think it's not a big deal? It's huge. 10 minutes a day of walking actually heals your brain. So do it. If you could do 10 minutes, that's all you got, go ahead and do it. It does not have to be, Orange Theory CrossFit with a cute outfit that cost you $150. It could literally just be put on your sneakers and walk around your block. It really could be that.
My mom and I listened to your episode yesterday together. We were on a road trip, and the long COVID symptoms one, because she had COVID in September, and then my dad just had it a week ago. And so I'm feverishly, and my mom's a nurse, but I mean, she's old school, right? Like she's almost 82. And she has long COVID symptoms. And literally her doctors are like, it's fine. Now we're moving into harvest season. You have allergies. I'm like, no, this can't be you have like this brain fog stuff. You've got
Yes.
some symptoms. So we were she was writing down all of the different supplements that you were suggesting. So I suggest anyone listening and you want to learn what long COVID symptoms are and then supplementation, listen to, which episode is it?
I don't even know. I don't know what number it is.
Or something. So listen to that. I'll put it in the show notes. But my question to that is the timing of the supplements, because there's quite a few. Do you recommend taking them at different times of the day to be the most effective with supplementation?
It doesn't really matter, with the exception of magnesium, which sometimes makes people tired. You take it at night, but nothing else on that list. By the way, if you want the list itself, I did a quick TikTok on it with just the list.
Oh,
so
great. Okay. I'm going to link that too.
Okay. That's just a list. Right? I did one that explains long COVID. And then people were like, you talk to the supplements too fast. And then I did one with just the supplements.
You do talk to the supplements pretty fast, Dr. E. You know your stuff. We had to go back. It was great. I'd rather have you like get it out. It's great.
Yeah, because I try to get it, like in 20 minutes. I go through it. I figured people can pause.
Totally. There's 30-second rewind.
Right? Yeah, exactly. So long COVID, it is a big thing. But here's the thing, it's not just COVID. It could be just about any virus that you had. If you still feel linked, because a lot of patients say, ever since I had this really bad cold, ever since I had mono, ever since I haven't been the same. The only reason we talk about it as long COVID is because it affected so many people that the conventional medicine is inundated with it. But viruses, for some people, they're just going to knock you off your game. Long COVID, I talk about it because it was really specific to how the COVID virus enters the cell. But the reason conventional medicine doesn't deal with it, again, is because there's no medicine for it.
Mm-hmm.
Because the treatment, right? The treatment is make sure you're not eating a lot of sugar, make sure you're anti-inflammatory, make sure you're walking, and make sure you're taking these supplements, because these supplements are likely depleted and you need to help what's called, ACE2. So who's going to tell you that in conventional medicine? Nobody. Again, no malice. There's nothing to do.
ACE2, I've never heard anyone talk about ACE2, and you kept like, it's so great to learn. I think everyone listening should listen to your podcast and watch your TikToks. I appreciate that. You learn so much.
I'm going to tell you, I research so much before I do every episode. It takes me about 6 hours every weekend to put a 20-minute episode together, because I want to make sure it's strong stuff. And as I was taking apart long COVID, I was getting angry. My wife was like, what's going on? I'm like, I am so angry that no one talks about this. I'm like, this is crazy. Why are we fixing everybody? She's like, calm down. I was like, no, because the more I went into the rabbit hole, the more agitated I got. I'm like, oh my God, this is real. It's fixable. So that particular one.
That's like infuriating, because it's like we could make so much of an effort to get everyone vaccinated. But then what happens after you have COVID? Why can't we talk about that? How to take care of ourselves? It's a real thing.
It's a huge thing. Yeah, I was. That one really agitated me. Sometimes I get very passionate about these topics.
I love it. Thank you for going over. It's 12:12. I want to be respectful of your next patient, because I know you got a full day. I'm going to sign up. I'm going to be your patient. I want to be your Dr. E. And Stacy, my executive assistant, she's the one who introduced me to you. And she's going to be your next patient. She's already signed up. She's like, a couple weeks, you're going to meet her. And she's
Oh, really? Awesome. Make sure she tells me the connection. Okay.
I will. You'll like her. So thank you so much for joining me. Everyone, please follow Dr. E on all of our channels. We'll have you all listed. And I guess any words of wisdom for us that we could have before you go?
Yes. There's a reason the book is called It's Not in Your Head, because I want you to know it's not in your head. And the reason I called it the new method is because you always knew there was a better way. Trust your gut. Keep going. Don't get frustrated. Just find the provider that will get it. That's it.
I love it. Thank you so much, Dr. E. Have a wonderful weekend, and thanks for all that you do.
Thank you for your time.